for this year's World Asthma Day that was marked on May 7th was focused on access to anti-inflammatory inhalers for everyone with asthma, still an urgent need. For me, I feel like the awareness is very key, and that's because a lot of people do not know what asthma is all about. They don't know what help to render to someone who is going through an asthma crisis. All right, on this edition of the program, our guest will be telling us the factors that trigger asthma attack and what to look out for, how to render help. If you are a colleague, if you are a friend, if you find yourself in, you find somebody around you going through a crisis, what are you supposed to do? All right. And for the people living with asthma, how do you manage this lifelong ailment? And of course, on Dr. Love's series this week, he'll be talking to us about eating habits. I know how it is for us on this segment because for the past week, he's been bringing very interesting topics, and all of us in Lagos, you agree with me that our eating habits, we eat round the clock because most of the times you are at work, you are in traffic, so you might be forced to eat, you buy street food or even take food from home. Whatever the case may be, you need to also learn from this eating habits episode with Dr. Love. All of these are more on this week's edition of Healthwatch. I'm your regular host, Nkem or Kibe. Trust me when I say I love to do this with you every week. We'll go on a short break. When we return, you'll meet my guest. Healthwatch continues in a moment. Stay with us.
It's that time of the year when we celebrate the joy of our lives and the future of our world. The NTA Lagos Channel 10 Children's Day Party! And memorable experience for our children. A day filled with fun, learning, and unforgettable memories where children get to meet new friends, enjoy exciting games, bounce in colorful castles, watch amazing performances from participating schools, and take part in creative activities. Major highlights of the party are match pass and beauty pageants. Come ready as there are prizes to be won. Lagos Channel 10 Gate fee 3,000 naira per child. Schools, families, and groups are encouraged to book early to help us prepare adequately. For inquiries, call NTA Lagos Children's Day celebration is not just a party, but a magical experience your child will cherish forever. Happy Children's Day!
Nakwana, Kedu, Odima, Ekason, Ekaro, Sonudezwa, Assalamu alaikum. How is everyone doing? Thank you. I am Dr. Love, also known as Dr. Yusuf Ademola Harun, CEO and founder of Love for Health Organization. And today we want to talk about something which is very delicious, and that is eating habits. Everybody loves food. I also love food, especially the ones with nice aroma of different cultures. Different tribes, either the Hausa food, Igbo food, Yoruba food, even English food. But there's something I want you all to remember. You are what you eat. And I also want to remind all of you that 9 out of 10 of people who have metabolic conditions or nutritional effects in their body is due to what they eat. Do we want to talk about diabetes? From people who eat excessive intakes of sugary foods, excessive carbonated frizzy drinks, to hypertension, those who take excessive salty food, excessive fried meals, or you want to talk about all other conditions associated with them. The end products are people developing hypertensive heart disease from long-standing hypertension, to diabetes type 2 from long-standing diabetes, and also we know that there are some cases of genetics in it. Yes, I agree. Some people have hereditary of hypertension and diabetes, but your feeding lifestyle goes a long way in making a difference whether you are going to be able to manage your case or whether it's going to get worsened. Many people worsen their medical condition and illnesses based on what they eat. Our lifestyle determines ourselves. That is why the common saying, you are what you eat. If you are eating excessive intakes of fatty meals, sugary, fried, salty things, you are just saying goodbye to what? To life, and you are welcoming the grave close to you. I advise you all, even when you are eating good food, do it in moderation. Eat slowly and take exactly what you need. Your food is just to relieve you, to nourish you, and to quench your anger. Many of the time, people eat more than what they need. They eat excessively. They turn themselves to gluttons. They become massively obese. And this is not good enough for your health. Just eat in moderation. Try to stay healthy. And most importantly, exercise. Do a lot of workout. You don't need to become Macho Man or Mr. Hulk Hogan. You don't need to develop six packs to look healthy. But try to take daily walk, even if it is 30 minutes. All this can have a positive impact on your health. When you eat well and you eat appropriately, you are going to have good health. You improve your cardiovascular system. You avoid deadly conditions like hypertensive heart disease, which is one of the deadliest conditions that are killing human beings all over the world. I advise you all to eat well, eat responsibly, avoid smoking, avoid drinking, avoid harmful and deleterious things to your body. And remember, we always love you. Thank you very much. I'm Dr. Love.
Thank you so much, Dr. Love. Very interesting segment on eating habits. Moving on, our guest in the house today is Chinemerem Okudo. He is a general practitioner. You're welcome to Healthwatch.
Thank you so much, ma'am. Nice to be here.
Okay, we talked about asthma at the intro, and one of the things I found out about asthma is that as long as we refuse or we shy away from talking about asthma, a lot of people are dying from asthma.
Yeah.
All right? It's not like the very obvious cancer or liver related or kidney related issues. For asthma, I feel like there's a low awareness on it. People do not really talk about it. So first, what is asthma and what's the difference between asthma and ordinary breathing difficulties?
Well, asthma is basically a hyperinflammatory condition. What does that mean? Let me try to break it down without having to speak too much jargons. Okay, so imagine a tree with its branches, okay, but it's inverted, right? Now that tree is the trachea and the bronchioles. So this is the back of the trunk of a tree with its branches. So when the back is kind of tightened because of some sensitivity or maybe some exposure, that is what triggers the asthma, right? So the bronchioles, which is the branches, or the trunk itself, that's the trachea, can become inflamed, that's swollen, right, due to those exposures, and they become causing maybe blockage and difficulty in breathing, right, or maybe persistent coughing in those people, right? So we're talking about the comparison between that and ordinary breathing difficulties. I think their differences are from, let's say, what causes it. Okay, the causes of ordinary breathing difficulties in you and I, or the normal person, is much, or maybe in some people when they're just having, like you say, cough or chest infection, they might have breathing difficulty. Of course, when it's that, we can know with relaxing, sitting down, being calm, you can be okay, right? Or maybe taking medications like your antibiotics. If it's infection, chest infection, you'll be fine. But in their own case, even more than that, something as little as AC, right, being exposed to cold, something as little as dust, something as little as smoke can trigger them. In addition to exertion too, do you understand? In addition to recovering from infections, any stress conditions, even in pregnancy in some people, right? Those things can trigger asthma, and those are like the key differences you can see in both of them.
So what are the factors that trigger asthma crisis in a person, or what are the factors that exposes one, to being asthmatic? Is there something like that?
Okay, yeah. Okay, so the major factors are they are majorly under. First of all, the person has to have had a family history. Okay, a family history.
So you're saying it's hereditary.
Hereditary.
It must run in that family lineage.
Yes, someone in that. But there's a factor of that. Okay, there's a factor of that. There's a factor of childhood exposure. Okay, some people, their environment in their childhood. There's this theory of people that if you don't expose your child to some allergens when they're younger, when they're older, they tend to have asthma.
They don't adjust to the environment.
Exactly. So if when the child is small, you tend to like put the baby in a bubble bath, like kind of like in a bubble, like, oh, I don't want my child to go and play outside. I don't want my child to touch the ground. I want to wear them socks and everything. So those things, those protection.
You don't allow the child to experience
exactly
the real African play. You play with sand. You play with different things.
So those things would in the future predispose the child to being triggered easily than his counterpart, his or her counterpart. Do you understand?
That's been exposed to all of that.
Exactly. So there's family history and there's that environmental. Then other things like the triggers can also cause it. Yeah, that I mentioned earlier.
So I was going to talk about something that happened. I was a boarder while growing up, and I realized that one of the ways to dodge some of those boarding school duties is to say, I'm asthmatic. So then, back in the days in school, everybody used to claim, I'm asthmatic. So I was like, is this part of, is it a lifestyle?
Even at home.
You know, is this something that everybody should be proud of? Is this something that you should have? And my story is going towards the fact that there was this girl, she was not asthmatic at the time, but she had just been treated with malaria, and she started witnessing shortness of breath. She finding it difficult, to do a lot of things that she used to do before. And all of a sudden, she went to the school clinic and she was declared, oh, you are asthmatic. I'm sure you didn't know this before now. So it's important that we highlight what are the signs and symptoms to look out for. Because one of the things that I remember was that she said her chest used to make sounds. And for us, it was even scary. We actually thought it was something spiritual, Yeah. So it's good that this kind of program is also creating awareness to people, for everyone out there, both young and old, especially for children, So what are the signs and symptoms to look out for?
Yeah. What you said just it brought something to my mind. It's something that is very important, especially for school age children, to actually be more aware of asthma, right? To help them be more empathetic towards their classmates that have asthma. Because you find out that when children have asthma, you find them wheezing, they usually laugh at them. When you see them with their inhaler, they stigmatize them. So things like that. It happens in schools a lot, right? It happened in my secondary school. I wasn't asthmatic, but I know it happened. Like I see them, people do that. I didn't know much about asthma then, right? But just now, this person had a serious condition that was scary. I mean, the sound's always scary when you're beside someone whistling, someone wheezing, because that's what it's called, wheezing. That's sound that they make. Okay, so they could be whistling sounds. Okay, so that whistling sound is like when they are breathing out. You hear this. That's what you hear when they're breathing out, okay? And they find it difficult to breathe in, right? So imagine you can't breathe in properly. You can't take it there properly. And when you want to release the one that's in your chest, it's passing through a very tight way. So meaning that there's air in your chest, but you can't take it out. So you can't take it in. You can't take it in. You can't take it out. So that's the issue they're having. But more on the taking of out. So when you have more difficulty taking it out, that sound, because it's going to a small pipe as the usual normal size, so you have this whistling sound coming out. Okay, some of them can have, because one thing about asthma is this: it doesn't just come. Like it doesn't just happen.
There must be a history.
Exactly. So if it's going to come tomorrow or next tomorrow, you could start seeing some signs here and there. Some people don't think much about it. Some people don't think much about it. Signs like chest tightness. So it's having this kind of, as if there's like a band on their chest. There's this tightness on their chest, right? They probably say, I don't know, maybe it's my tight clothing. Maybe it's what I'm wearing on my chest. Maybe that's what. Okay. Some people start saying, oh, that they say that, oh, they cough a lot. They say that they cough a lot, and they wonder, maybe is it because I was exposed to cold water, or you say, I'm just coughing. I don't know. Maybe it's cold water. Maybe it's what I ate that was fried or something, which is a myth, by the way. Fried things doesn't cause asthma. Right? So those things are. So you can notice chest tightness. You can notice coughing that is not productive. When I mean not productive, I mean that nothing's coming out. Just be coughing, but there's nothing coming out of it.
And it's not dry.
It's just the dry cough. Just nothing. Just
and there's no sputum.
No sputum.
Okay.
No sputum. Okay. Then the whistling sound. Okay, those are the 3 major things you might notice in the person. Okay.
Let's talk about the fact that some asthmatic patients might not really need inhalers. Some of them might just need to go to the hospital and use nebulizers. I don't know what's the difference between the two. So you see some that always have it in their bags. It could be triggered at any time. And some could stay for years, no crisis.
Yes.
And when it comes, probably they are just recovering from an illness,
Yes.
or they travel to a different environment. So like you go to Canada, all right. So you just see that you're already you're not getting used to the environment. So you're having this crisis all the time. So what's the difference between using an inhaler and a nebulizer? At what point should an asthmatic patient always be with his or her inhaler?
Okay. Thank you for that question. There's no particular point. Once you are diagnosed as an asthmatic, you should have your inhaler. You should. Okay, you should always have your inhaler with you. You shouldn't say, okay, mine is not that severe. I mean, my medicine, I shouldn't have to take it everywhere. You don't know when the crisis is going to happen. Okay. You might be there are some things that you can see here and there that can help you. So I might be having a crisis soon, like I mentioned earlier. You see those persistent coughing, maybe just kind of chest tightness, maybe some weaknesses. You can notice, maybe this always happens around, right? So you can, or maybe you're in travel to Canada, like an example. So when you travel to Canada, of course, the temperature here and there is very different. So their climate is very different from ours. So you notice that the amount of time you expose situations to make you understand, you should have your inhaler. But that doesn't mean that you should keep them or say, no, I don't have, mine is mild and everything. Always have your inhaler. For nebulizers, right, when you're in your home, in comfort of your home, it's always better to use your nebulizer, especially when you have like, it's always better that way, okay, because nebulizer help the component of your inhaler to get inside easier and better. Okay, that's why when you're in your home, you can use a nebulizer, the spacer. Right, it's like a longer tube right, attached to the inhaler. It's to help the particles spread out easy. Right, when you take an inhaler. Okay. Yeah.
So the big question: can asthma be cured, and how would asthmatic patients stay healthy?
As a medical practitioner, medicine right now, currently, asthma cannot be permanently cured. Okay. Of course, I'm a Christian too, right? And I believe in miracles. Yeah. But medically, asthma, as of now, cannot be permanently cured. However, that doesn't mean that you can't have a full life. That doesn't mean you can't enjoy life to the fullest, right? I hear people say, "Oh, I'm asthmatic. My son is asthmatic. He shouldn't play ball. My son is asthmatic. My daughter is asthmatic. She shouldn't do that." You can do exercises, right? There are a lot of asthmatic athletes. So you just have to be conscious of your condition. You have to be aware. You have to have your inhalers. You have to be up and doing with your regular appointments with your doctors. That I'm saying to put. So you have to be going for regular appointments. You have to have your medications. You have to know what your triggers are. I think with those things, you're able to manage, because it's chronic, right? But you'll be able to manage. It's highly controlled, highly controlled. Yeah.
Very good. It's so reassuring to know that it can be managed. And I like the last word, know your triggers. I have a friend that cannot stand perfumes.
Exactly.
Even the mildest of perfume, she's telling you, "Hey, I'm choking, I'm faint."
And it will be confusing, but to her it's actually choking, right? Every other person will be like, no, I don't understand. This is not harsh enough, but to her, yes, it is. Alright, so it's left for that person to just know, when this is her own trigger, she doesn't start around those things. Just avoid it. Just avoid it as much as possible. People have different triggers and different severity of those triggers to themselves.
I like you also debunked the myth around fried things, because I used to ask myself, fried things, fried chicken, fried chicken, excuse me, fried meat, fried fish.
There's a lot of.
How am I supposed to do that? All right, so I'm like, someone that is asthmatic and you see fried chicken, fried fish, are you going to say, this is a trigger?
There's a lot of those myths going around. I don't know. I mean, mine is not asthma, right? But I actually had skin reactions when I was growing up. It was really bad. I had to wear long sleeves going to school. Right? Yeah, people said this boy likes to dress with sweaters and everything, but I was trying to hide my reaction. I had to figure out myself. I have to like take a diary. Yeah, that's important. Yeah, I just remember now. So if you're asthmatic, please
Take a
have
diary.
a diary.
Okay.
Know your triggers, noting them down. Right? So you know that, oh, 1, 2, 3, 4 are the major triggers that I have.
Okay.
So whenever you see have those like the red lines, you don't expose yourself to them. You don't try to expose yourself to them. So I have to like have a diary to note, oh, is it this? Whenever I notice what happened to me, what's the situation around it, and I figured out that, lo and behold, mine is mosquito bites.
Oh, okay.
And I had rashes all over because of mosquito bite. Very severe rashes.
Because we were reacting to them.
Yeah, it's mosquito bite.
So very quickly, and final question: what should family members, bystanders, friends, what should they do when you see someone going through having an asthma crisis? What are you supposed to do?
Okay. As a bystander, as a family member,
As a friend,
as a friend, as a colleague,
classmate,
whoever you are, whenever you see someone in asthmatic crisis, I think it's very important. And the first or foremost important thing you should do is to calm them down. Try to like calm them, because even someone that is well knowledgeable about his or her condition, knows their triggers, in a crisis they can start panicking. Like it's that severe. You know, the airway is very important. Not being able to breathe in and breathe out is very bad. Like can be very bad. That person can start panicking, and panicking doesn't make it better. It makes it worse, right? So as the best I try to make them feel calm, right? And that is where prayers. When I see people pray, as I have no issue people praying, right, regarding asthma and all this, because prayer to some people is like gives them reassurance. It calms them, it makes them feel better.
True.
Right?
True.
So if you want to pray, maybe you are praying for the person, the person hears you praying, maybe makes the person feel better. Right? If the person is lying down, try to sit them up. Okay, let them sit up so that they can use their respiratory muscles, can use their chest to breathe. Okay, so sit them up, calm them down. Like I said, when they're in asthmatic crisis, their chest feels like it's tightened. Right? So anything that they're wearing that feels tight, their clothes, ties, collar, whatever. If it's tight, just unbutton, right? Remove the clothes if it's tight clothes. Then they should have, or I'm assuming at this point, they should have their own inhalers. Okay, seek for the inhalers. Yes, I forgot to mention, there are two types of inhalers. There's a preventive and there's a rescue inhaler. Okay, so when someone is in an asthmatic crisis, if someone is in crisis, you're supposed to use the rescue inhaler, not the preventive. Okay, the preventive inhalers are the ones they take daily to prevent the crisis from happening. Okay. But when the crisis happens, they use the blue one, that's the rescue. Okay. Okay, so when the person has the crisis in front of you, the one you're supposed to use is the rescue inhaler. Okay. Okay, so you take one puff for 1 minute, right? Then you keep observing them, then repeat it. Okay, you can take up to 8 to 10 puffs. Okay. But I mean, one puff for 1 minute.
Interval of 1 minute.
Interval of 1 minute, exactly. So you can take up to 8 to 10. Now, at that point, they should be feeling better. But if they don't, right, they start notice that, oh, they're not feeling better at the 5th, 6th, 7th puff, 8th puff, they're not feeling better. You can go to maximum to 10. Don't go beyond 10. But at 8th puff, they should be feeling better. If they're not feeling better, then you know you have to call for
seek
help.
medical attention.
Yes, or get them to the hospital as soon as possible. If you notice that they are, for some reason, it's becoming worse, they are struggling to breathe, or you start noticing something called skin tugging at the throat here, all right? So you start noticing that this place is going inward, right? Because they're trying to breathe, so it's going inward. Then you have to take them to the hospital.
Wow. Thank you so much, Miriam Ukudo, for coming on the program.
You're very welcome.
And for me, the highlight of today's interview will be know your triggers. So you know that you react to perfumes, you know that you react to smoke, you know that you react to AC, you just know what you react to. You take care of yourself as an asthmatic patient. And for all of us, we have somebody around us, probably in our class, at work, even in your community. That's why I said bystanders, all right? You know what to do when you find somebody in an asthmatic, going through an asthmatic crisis, all right? You know what help to render. And that's the much you can take on this week's edition of Healthwatch. Remember that I normally say health conscious people live longer. You have a question, you have inquiries, you'd love to sponsor this program, reach out to us on 0706086547 or send a mail to okibeinkem@gmail.com. Shout out to all my crew members, from the production crew to the engineering guys. Thank you so much for making sure this program comes on air every week. My name is Nkem Okibe. See you next week, same time, same station.